Thank you, Mr. Chairman, and thank you for your leadership to where you've gotten us today. I appreciate it very much. Mr. Chairman, more than a half-century ago, Harry Truman said, "We should resolve now that the health of this nation is a national concern, and that the health of all of its citizens deserves the help of all of the nation." Well, the time has come for us to act. This markup is an important moment for reforms delayed decade after decade after decade. To those who say our current health insurance, our current health care system is the best we can do, to those who believe that more of the same is what the American people deserve, I say that allowing a health insurance company's profit margin to come between a doctor and a patient is no way for a health care system to run. That leaving tens of millions of our fellow Americans to rely on an emergency room for their primary care is no way to treat our neighbors. And I have heard many speeches on the Senate floor about how we need to treat our neighbors and the importance of our neighbors' lives. And it certainly is no way to control the budget deficit. There are issues with our health care system that should eat at our national conscience every day. Middle-class families in this country who have health insurance are being bankrupted by health care costs anyhow. And when they need insurance coverage the most, it very often simply isn't there for them. They get denied and denied and denied. Throughout my 17 years in Congress, thousands of New Jerseyans have approached me on the street, visited my office, or called on the phone, sometimes in tears, to tell me their health insurance stories, some of the most heartbreaking stories you will ever hear. And millions of other families who may not be facing dire circumstances are nevertheless worried that their insurance is costing them more and more each year, that they've been denied coverage for a test or a visit to the doctor's office. These are the stories that exist under the present system, stories that almost every family has. These are the reasons we need to follow through with meaningful health insurance reform. Now, I applaud the Chairman's leadership in getting us to where we are today, and I appreciate him listening to several of the concerns we've had and trying to incorporate it. But I also know the Chairman is well aware that my focus is not just on passing any bill called reform, but on enacting actual reform that ensures that every American has access to quality and affordable health coverage. As such, there are some changes to the mark that I hope to see. We have to make the insurance exchange more affordable for average working families regardless of where you live, a big issue in a state like mine. That means reducing the amount families spend on health care as a proportion of their budget, helping families who sit around the kitchen table trying to stretch their paycheck to cover the mortgage, groceries, and health care costs each month. We have to ensure that a tax on high-value insurance plans does not end up hitting middle-class and working families in states like mine, many of whom are serving the public as teachers and firefighters and police officers. And we should not let the hysteria over immigrants block American citizens access to health care they deserve and are entitled to. We need to strengthen consumer protections as much as possible, and I have offered a number of amendments, many of which hopefully will be accepted by the Chairman, which provide protections and support to families in getting the care they need. And I've also offered amendments to protect federally qualified health centers, maternity coverage for young women, and better care for our nation's children, including those with autism. And I believe we need to ensure a level playing field for every consumer. And that's why I'm a strong supporter of a strong public option. To truly level the playing field, we eventually need a discussion of a public plan in the insurance exchange. And to my less than progressive friends, we need transparency and accountability in the market, and to ensure real, honest, fair competition among qualified insurers. We need to create a new framework to throw out the old business model that says insurers should do all they can to avoid risk rather than provide the best value at the best price to the most people. Finally, Mr. Chairman, I know that there are legitimate disagreements in the committee that are ideologically based, and I appreciate that. But I also have a real concern when I listen time and time again to things like death panels that never existed and would never exist. I have a real concern to hearing the constant refrain of the government takeover of health care when not only can this be a boon to the insurance industry and it is based on the private marketplace that exists, but also when this plan does not even call for a public option in the present mark, and yet we hear a government takeover of health care. I have a real concern when I read in today's press that the National Republican Senatorial Campaign Committee has already its eyes on Democrats, including those up in 2012, a little futuristic looking, and plans to bombard Democrats who sit on the Finance Committee with attacks on their votes on controversial amendments during the committee's deliberations. This is quoted from an article today. And their spokesperson says if senators bow to the pressure from the White House and liberal special interest groups and think no one is watching, we will welcome that false sense of security. But the NRSCC intends to actively inform their constituents if they put the political interest of their party's leadership ahead of the interests of the taxpayers in their states. So then I wonder whether it's ideological divide or partisan political opportunity. And when I hear that this could be President Obama's Waterloo, again, I question the sincerity. So, Mr. Chairman, all of us, it is shameful, I would think, to suggest that political opportunity comes by virtue of not reforming health care, because that's not about President Obama failing. It's not about this committee failing or the Senate failing. It is about failing the American people. All of us have a stake in the result. All of us want to ensure that every American family has affordable access to the best health care system possible. And all of us who believe, as Harry Truman did, that the health of the nation is a national concern that deserves the help of all of the nation, has an opportunity to act now. Let this be the time, and ours the generation, that finally realizes the dream held by generations of leaders, from Harry Truman to Ted Kennedy. Let's make affordable health care for every American a national priority.
Thank you very much, Senator.